At Davos at the World Economic Forum 2026, Banega Swasth India, here we gather to spotlight women's health, dignity, as well as progress, recognizing that economic empowerment is inseparable from well being and that technology, including artificial intelligence, must serve as a catalyst for inclusion. Together, we can reimagine a future where every woman's health, voice, and opportunity are non negotiable. Today, we have some strong voices here with us. Let me quickly introduce. We have with us Ms. Smriti Irani, Chairperson Alliance for Global Good. We have Nishma Gosrani, Global Financial Services Partner, Bain Company. We also have with us Vaishal Nigam Sinha, Co-founder Renew and Chair Center for Women Leadership. And we have Dr. Komal Goswami, Chief of Party Plan International. Thank you all so much for joining us today. I think to begin with, when we talk about women's health, Smriti ji, my first question to you would be, in India, when we look at the maternal mortality rate, it has improved significantly. What more could be done to actually not see any mothers who are giving birth to their children still have to face any consequences while childbirth?
I think when you look at women's health, we should not compartmentalize it only from the perspective of maternal health. Given that the population size of women in our country, we have possibly the opportunity of becoming that one center for innovation for women's health, which can be replicated around the globe. I think today the alliance that you speak of has in fact become the harbinger of those realities to the fore and to a global platform like Davos. This morning, we had a very young female entrepreneur declare an investment of $40 million into the area of women's wellness for brain health, for hormonal health, and for bone and joint health. And the fact that in Davos, that announcement is significant from the perspective of traditional medicine systems that we see in India. This is an announcement steeped in Ayush, which has the blessings of the ministry. The fact that a young female understanding that various life journey cycles of women need various varied responses, that I think will become quintessentially the fulcrum of how women's health will be envisaged or looked upon. I also think that when you look upon the issue of women's health, it at a very early stage begins with nutrition and sanitation. Many people presume that a well-nourished woman is all about ingestion of food, but we need to recognize that sanitation plays a very dominant role in how women are healthy or how our children are passed down those healthy habits. So it is not an isolated issue. There are many layers of engagement on women's health. It is a social and economic imperative. We may look upon it from a moral lens, but I think that as long as it has an economic hat on it, you will find many people who will want to partner in solutions.
I think what you rightly said, taking from there the economic hat, and that's why we have Nishma. What is your take when we've been speaking about it, that very often women, they study a lot, they're educated, you run CEO clubs, globally, you work with Indian CEOs as well. But when it comes to women, often they have to give up their careers even after being educated. That impacts their mental well-being as well. And we cannot forget it's 50% of women, today when we talk about the economic development as well. How do you think that can be balanced and why is it important to do that?
I think, Ambika, there are a whole host of things that you've just touched on there. I think fundamentally, we cannot see women move out of the workforce, which often happens after childbirth. And this is endemic of a woman anywhere in the world, a global Indian woman anywhere in the world. This is not just for India, that we see that women leave the workforce and they have a huge amount of difficulty re-entering the workforce if they don't do it in a short space of time. Now, that has a direct economic impact. So they've been educated, they've gone to university, or whatever it might be, and then they're not returning to the workforce. The other aspect of that has become hugely pertinent recently is that we're then seeing mental health impact on those women who are not able to return to the workforce, having spent 10 or 15 years in the workforce, having given it their all, and actually then they realize they've climbed a certain point of the ladder, but they're not able to return on that. So there are two aspects to that, but I think that we're in a very privileged position today where, many of you are going to say, oh, here we go again, but I think AI has a great play here. We are seeing AI move at breakneck speed at the moment. And I think if you look at the way data can be collaborated around women's health and the interventions that can be made, that is going to be significant in the way that we change the way in which women get what they need at the early stages of their life in order to have a much more fulfilling life later. Now, one of the issues with AI that we're seeing at the moment is that there is a significant bias, particularly around health, towards men, because the data that is collected is based on all things related to men. So there needs to be some shift in the way that that data is collected. But I think we're seeing some level of movement on that. It's not as fast as one would like it to be. I mean, lots of medicines today, if we think of the breakthrough around cancer, for example, is still very much focused on men. One of the things that I've been involved in from a financial services lens is I was instrumental in pioneering what we today call gender pay gap reporting in the United Kingdom, but then more broader across Europe as well. Now, the idea of gender pay gap is that you look through an organization's statistics, men versus women, you think about the gap that there is for the same job that is being performed, and you try and understand why a man is being paid more than a woman. I think that some of the lessons from that can be applied into health as well, in terms of data collection, the interventions that then need to be made by leaders in the society, by corporates and others to change the way in which women are categorized, considered, and how their life is then fulfilled beyond that.
I think that's really well put what you said about AI. And again, coming to you, Vaishali, about climate change. Again, climate change directly impacts women. We've seen it in many ways as well. You work in that space. Tell us again, how can we bridge that gap using AI, using technology, and even clean energy?
Sure. No, thank you. So as far as climate change is concerned, I just want to say that climate change actually is biased towards gender.
Yes.
I think women tend to suffer a lot more. 4 out of 5 women are suffer the negative impact of climate. So, when you look at clean energy, women are, because they are not using chulas and other sort of sources of fuel which, impact their health, there are 3 things clean energy can do. One is helps with better health and well-being, not only for the women, but if you go to the villages, you'll see women are not only sitting in front of the chula, or did once upon a time, because things are much better now after the Ujjwala scheme, where it's really positively impacted lives of women. But they also have their little children sitting there. So it's really taking care of their own health and the health of their children. Yeah. So, good health frees up a lot of time. Yes. And once you have time, you can perhaps take care of your families, you can engage in productive work and earn more, become more independent. We see small entrepreneurial sort of ventures coming up, women going and earning more money. So we have a program called the Surya program, where we are reskilling salt pan workers to become solar technicians, which what that has done is it's enabled these young women to first, save themselves from the drudgery of a really, bad life, which had impacted health of their grandparents and grandmothers and mothers. But it has also helped them to go get skilled and work in an area which is up and coming and blossoming.
And empowered them.
And empowered them not only to get a job, but to set up ventures as well. So I think these are the ways in which I think women become way more productive once you have access to clean energy. And
So that's again plays a critical role. In fact, I wanted to talk about self-care. There's another important aspect when it comes to women. Dr. Goswami, you worked on our campaign. We worked together, Banega Swasth India, for 12 years now. Tell us a little bit about the things which the campaign has been doing and which has been impactful when it comes to specifically women health, whether it's AI, whether it's using AI technology or even on ground.
Thank you, Ambika. So first of all, thank you for putting this panel together. This collaboration is actually the answer of all the questions that we have been asking in World Economic Forum Davos. When we talk about self-care, and especially on women's health, so this Banega Swasth India have been implementing this program from last 12 years. And we have recently, from last couple of years, started talking about self-care for women. A new concept that nobody knew about, especially we come from a country like India, where everybody talks about awareness, access, affordability. Nobody talks about agency. Agency is actually something that empower women to talk and ask for themselves. If our women are more empowered to ask for themselves, then the concept of self-care plays a very critical role. Because when we talk about women health and child health, it starts from very early on. If we really want our women to succeed, then a lot of imperative and confounding factors like early marriage, education, adolescent, reproductive cycle, hitting puberty, and a lot of things play a lot of vital role. So the concept of self-care starts from very early on, and that's why program like Banega Swasth India have been a part of the larger campaign, which is called which was by Shri Modi ji, and it's been last.
So I think
10
taking
years.
from what you said, it has to start young.
No, I think that I would disagree on one issue.
Sure.
It is not as if that women don't know how to take care of themselves. It is about affordability. Let's be realistic. The Ayushman Bharat campaign by the Prime Minister, which makes affordable healthcare available across over 28,000 hospitals for over 1,300 different medical challenges, has seen some fantabulous numbers coming through, especially for women and the health ecosystem in our country. That we've had over 48% cards that have been distributed thus far have been taken by women. If you look at only cancer of the cervix and the breast, the number of screenings have surpassed over 20 crores. And I think that in itself is most significant because culturally there was a presumption in our country that women would not possibly societally embrace these screening methodologies, which either are available but not affordable, or for that matter, even if they are affordable, women would be culturally restrained to take them. So I disagree that self-care is something which is not evidently universal in our country. Every woman in India, irrespective of her economic background, knows the only question is, can she afford it? And the government, in fact, has demonstrated that when affordable healthcare is made available, especially to the economically most weak segment in our society, women do rise up and take that opportunity to get themselves not only tested, but also avail of medical benefits from our healthcare ecosystem.
So along with, of course, affordability, the government is trying to ensure there's accessibility as well.
Accessibility, Nambika, I think that what women in our country have exceptionally exhibited also is through our frontline workers.
Yes, the ASHA
Our
workers.
ASHA and Anganwadi workers and their the ecosystem of assistance make it close to 6 million women who are at the front lines of healthcare systems in our country. COVID was that great testing time when these women went from door to door collecting samples, from giving medical help as and when needed. And I think that the exemplary work done by female frontline workers is, I think, something which needs not validation, but more appreciation globally.
Yes.
Given that they exhibited on ground capacities during a global pandemic that not many had an idea as to how to deal with it. And today your panel itself, if I look between Nishma and Vaishali, they are leading in some of the most, I think, non-conventional fields. Nishma spoke about the pay gap report.
Financial, yes.
Now imagine the fact that you do it in an economy where it is not spoken of, an economy like the UK where people presume that equity must be ingrained in that economy. The fact that Nishma could highlight as a professional the gap per se and still be a corporate leader of repute, that speaks volumes about the capacity of Indian women or women of Indian origin. The fact that Vaishali today can be celebrated as a founder of a renewable energy company, but when she began, that was a no-go area for women. Not as a workforce, but predominantly as
Breaking
founders.
through as well.
So Indian women or women of Indian origin have done groundbreaking work. The issue is, have we done enough to recognize their leadership?
I mean, that's really, really well put to the point. And I did want to talk to you about adolescent health as well as menstrual hygiene, which I will come to you quickly
In fact,
after.
like I said, to join the great lineage of the Vaishalis of our country and Nishmas, that is that young girl seated in that one corner who's just been audacious this morning to announce her investment only on women's health.
Absolutely. In fact, I spoke with, and the kind of work which she's doing is amazing. Yeah, well done. Big round of applause to you, in fact. Yeah. Nishma, again, you know what we've just been speaking about. I think the role of spouses, again, it plays an important role, whether it's you've spoken about gender equality, paid parity. How important is it for the men of the family also to support women so that they really can reach to their potential?
Yeah, I think it's a really interesting question, Ambika, and I'm very keen to get Smritiji's view on this as well.
I don't want to think what she's going to react to.
I think
the question.
Yeah. So
I think the question itself conditions women to seek spousal support.
No, because
Nishma,
Nishma and I had discussed a certain, a difference because somewhere we did feel that there is still a gap.
No, but my issue.
Why do you need the man?
I think Nishma.
Why do you need the spouse?
Nishma has been a bit adventurous by pulling me into that conversation because I think she anticipated this reaction from me. The fact that we make spousal support central to how a woman grows is in itself a manifestation of the very bias that we are hoping to fight
So we're
against.
vetoing that question.
And the fact that there is no man on the panel.
Yeah. And also, I just want to also come in very quickly on this. Just one quick point. At Renew, in our company, I just want to say that when we talk about mentorship, we talk about women mentoring men. I don't think women need mentorship. Says who we need mentorship.
I absolutely agree.
That kid who announced this is the biggest investment announcement in Ayush in the history of our country. And she's not even married.
Yeah, so the spouse question is vetoed.
I think
but you did have an aspect to it.
So this aspect is that I think things have flipped around, right? The women across the world are becoming breadwinners in a way that they hadn't historically. And so the spouse is having to play a different role. And when you think of the Indian man in particular, that makes things very tricky. I think the other aspect is that if you look at female CEOs in India and China, there are far more female CEOs in those two countries as opposed to in the West, which in itself is really interesting because it lends to the fact that intergenerational families that support children within the family or young children is actually very beneficial to a woman having a senior career. Which is actually not the case in the West, where childcare is extremely expensive and you think 3 times before returning to work. So some of what exists in India has become realized today is actually it works extremely well. And having spoken to a number of Indian female CEOs across financial services, many of them like Zia Modi or Shanti or Kalpana Moparia or Renuka Ramnath and others would say that they've only been able to go back to work because they've had the system and the support at home. And I think that's become instrumental.
Yeah, and if I could just add to that,
Please,
I really do feel that, we do have the support in the family in India, but I think it's important for women to step up at work and for men to step up at home. Because if that doesn't happen,
it's a partnership.
I think women are going to always keep trading their position and ambition at the workplace with what they have to do at home. And so I just wanted to say that it's really important. So the whole we really need to get men engaged elsewhere so that we can do more.
Then I guess you're answering the question, can a woman really have it all? No.
Of course we can.
Of course they can't.
So that's the conversation we've had.
I'm on the of course we can.
Ambika, also, I know this is expert panel. So in the morning only, I was discussing with one of my colleagues. So there was a panel that we attended. It was on getting top female force, female talent in AI. So the idea is why to add top. We never talk about top male talent in AI. We always talk about male talent in AI. So just that. So as Smriti ma'am and everybody has been talking about that, men and women, I think we need to take the dialogue.
I think that if there is a male component to the family structure that needs to show support, which becomes quintessentially very foundational to how women undertake a particular professional journey, it is actually the father.
Yeah.
And I think men or women replicate in some way or the other psychologically the relationships that they see between their parents, and especially how a father reciprocates to a particular family system, how he reciprocates to, let's say, his own spouse working, how he reciprocates to other women in the family system. So, for fundamentally a woman to get affected most, I think, foundationally, is the role of the father in the family. Wherever the father has been able to secure a sense of equity in the daughter from a very young age, that actually, in some way, translates to how women actually even look at a partner. So, if there is a male factor, it is actually the father that one would
There's an impact.
look at.
I just wanted to also say, and how that impacts the young boys in the family. So I always
Absolutely, yes.
use the example in our family. I have a husband, one, and a son and a daughter. And, when my daughter was growing up, my husband used to try to be the school dad, and he would share these feminist articles with her. And she would write back saying, "Dad, I'm all right. Share it with the little one." So, I always say that, my son's going to make a great husband because he's been so sensitized by the relationship he's seen between the father and the daughter's sense of, wanting the sort of fair share and parity. And so I think
grown
what
up like that,
happens
like,
in a household.
in a family, that's what I think.
really
what
I
you
also
said,
feel
things-
that if a family sees a mother self medicating and not prioritizing her own health, and taking the family savings or taking the family income and prioritizing the health of the male member of the family, that in some way kind of impacts how the woman then, as she grows older, will spend on her own health or self-care for that matter. So even how the economic ecosystem works within a family unit, it impacts the consumer behavior of the female when she herself has economic means to kind of either process something in her life or invest. Even her investment decisions are impacted. So while we are talking about globally, or for that matter domestically, of many issues with regards to women's health, education, or financial prospects, we need to understand that behavior as a consumer, that behavior as a leader, that behavior even as an enterprise, it all starts from how the family system teaches a woman to spend,
Yeah.
to save, and to earn.
So, Smriti, just based on what has been said, so some of the research that Bain did in India lent to the fact that to get back to your point around the economy, that in order for the government of India to achieve Viksit Bharat by 2030 and then its next iteration by 2045. Sorry, do you believe that you're going to have to get more of the female workforce with digital skills, with AI skills, and turned into data engineers in order to not just fulfill the requirement in India to meet your own Viksit Bharat sort of mandate, but also the world's mandate?
I think that the way the
how far have you
government and
gone?
the Prime Minister particularly has brought the issue of women central to his governance model speaks volumes about how next steps are to be taken towards 2047. I will take you back to 2014 when he spoke about building a toilet for women. It was more about the dignity of women. It was not looked upon as a politically glamorous promise to make. It was never a part of his manifesto. The fact that he had an overwhelming majority and then spoke about building toilets, then spoke about giving clean fuel to women who are from very poor families, then worked on issues like affordable healthcare for women from BPL families, and also understood that if women have access to capital assets, then they feel financially more secure in a family system. And then the Prime Minister's housing scheme intervened to have joint ownership or single ownership by the female in the family. He has already laid the foundation of ensuring that how women are envisaged in Viksit Bharat or the journey forward, how that is to be envisaged, that foundation has already been laid. Mudra, for that matter, was not actually a a gendered financial instrument. It was an instrument of helping give credit support or capital to small businesses. The fact that 70% of the uptake was done by women speaks volume about the potential of women.
In fact, Smriti, you said that building a toilet way back in 2014, and that's when we launched the campaign as well, was for dignity. And that's what we're calling our panel today as well. But I want to ask you something about hygiene again, dignity, when we talk about menstrual hygiene, when we talk about teaching the adolescents from the very beginning, teaching the children young. That also plays a very critical role towards
Prime
achieving
Minister
Viksit
Modi
Bharat.
is the only head of state who has stood on Independence Day of his country from the ramparts of the Red Fort and said, there is a 1 rupee sanitary pad which is available. I have never seen a head of a state actually ever speak like that, which means that if society was squeamish about menstrual hygiene, here you have a prime minister leading from the front to say, I've made the product available at an affordable price across the country, especially in Jan Aushadhi Kendras. Because one of the greatest challenges that women faced was access to affordable menstrual hygiene products. So the fact that the Prime Minister not only spoke about it, the first ever protocol for handling of menstrual hygiene waste products in our country was set by Prime Minister Modi. So he has looked at the whole ecosystem, from ensuring that there is a product available to dispensing of it and ensuring that there's an administrative protocol. And we've had a female prime
That is
minister.
the basic of hygiene.
No,
right?
and I'm saying that the irony is that we've had a female prime minister.
It wasn't done
Mr.
by.
Modi, the Honorable
No,
Prime
I just
Minister.
also want to say that for young girls, things, messages like this make a huge difference.
Yes.
And so, when the prime minister, the leader of a country, is talking about something they're so uncertain about. I mean, we've lived in an environment, not me, but large part of India, where you're not allowed to enter puja spaces,
temples,
kitchens,
touch
various
pickles.
rules. And you can imagine what that does. Like if somebody is not allowed to enter the space because of a certain, gender or whatever, it really lowers your self-esteem. And that's what we've seen as well, even at work. When you have women who are smarter intellectually than men, the confidence they have is not as much occasionally. And that stems from, when there is a girl, visualize a 5-year-old girl waiting in a hospital, a little baby is born, the baby is a girl, there's a certain response because it's a second girl child. Once upon a time, not as much now in the current
It's changing,
India.
but it's still there,
Changing.
unfortunately.
It's a boy. There's celebrations, laddu, peda, everything, right? What does that do to the girl's sense of, self? And so it's those small unsaid messages which really impact a girl's, sort of self-confidence. And I think the home has a very important role to play in raising young women who are confident and can take on the world.
In fact, that's why we're having this conversation here with 4 strong women, talking about why this is the need. Quick closing remarks before we, I'll start with you, Komal. Why is there a need to be speaking about women per se at the World Economic Forum?
Ambika, so like the title of the panel is health and hygiene. So we cannot dissociate health and hygiene, and that's what we have been talking about. When we talk about hygiene, it's menstrual hygiene, and like Smriti ma'am told, that we are talking about. So there are panel now like menstrual hygiene summit. We never once thought about that India will be talking about menstrual hygiene summit in a global level and conference. So we have come far with the efforts of the government of India, and that is something that I take.
So they go hand in hand.
Yeah.
Vaishali.
Well, I think we should be talking about what we should do with men and what men should be doing.
What we should do
I
with
don't
men.
think
I love
we
that.
really need to have these conversations, but it's nice that we are having it.
Great. Okay. That's a different...
I would say one of the biggest things at the World Economic Forum today is that every single one of us has a societal responsibility to stop a woman leaving the workforce or encouraging them back to the workforce.
Very, very strong point.
I think
Smriti ji,
that
last word to you.
between Nishma and Vaishali, for any Indian girl who's watching us right now, and that young kid who's seated there, Yutika, come here. This is NDTV, for heaven's sake. If you make it here, then you make it in your market.
That's really sweet of you to say.
So the camera person, that's that young girl who has... So between the 3 of them, that is our response to the world. that it does not matter what your age, what your community, if you have Indian genes as a woman, then there is much that you can establish with empathy, that as a leader you will be inclusive and resilient, that as an innovator you will be a path breaker. But I think what is most I think for me as a woman, an issue that I celebrate about these three women here is that they take others along in their journey. That they go through their journey, through all the
Women for
difficulties
women.
and the challenge. But the best response we can give to other women is to help lend a hand and take them along.
So, women for women. Well, thank you all so much for joining us today. Thank you so much.